Hello and welcome to the Council of State Governments webinar series. My name is Bryden Ross and I'm the Director of Energy and Environmental Policy at CSG's headquarters located in Lexington, Kentucky. Today's event, Understanding How EPA Clean Air Rules Are Derived, will feature some impressive experts that will offer competing perspectives to help encourage discussion and thought-provoking questions about how cost-benefit analyses used for EPA regulations are developed. As you know, many of these regulations can be fraught with controversy, both in support of them and against. So as state leaders, these experts today will help you make more informed decisions as you are faced with regulatory and environmental policy challenges. Our first panel will feature Dr. Michael Honeycutt. He's the Director of the Toxicology Division of the Texas Commission on Environmental Quality, Texas CEQ. He has been with Texas CEQ since 1996, and he oversees the health effects review of air permit applications, ambient air monitoring projects, and reviews of human health risk assessments for hazardous waste sites. Dr. Honeycutt spearheaded the updating of Texas CEQ's effects screening levels, or ESLs program, and toxicity factors for chemicals. He's an adjunct professor at Texas A&M, has published several articles in peer-reviewed literature, and served on numerous external committees and provided testimony before congressional hearings. Also on the first panel is Dr. Stephanie Shirley, who is a toxicologist at Texas CEQ as well. Her responsibilities include conducting and reviewing health effect reviews of ambient air monitoring data and projects. Dr. Shirley serves as a technical resource for the agency management and staff on issues concerning air and water quality, drinking water contamination, and soil contamination, as well as participating in public meetings. Our second panelist will feature John D. Walk, who is a senior attorney and Clean Air Director for the Natural Resources Defense Council, NRDC, which is located in Washington, D.C. He's held that position for more than 10 years. He's responsible for NRDC's clean air advocacy before Congress, the courts, EPA, and the public. Prior to joining NRDC, John worked for the EPA in the Air and Radiation Law Office of the Office of General Counsel, where he worked on permitting air toxics, monitoring, and enforcement issues under the Clean Air Act. Before working at EPA, John was an attorney in private practice, and he received his undergraduate degree from Duke and his law degree from Harvard. He's also appeared numerous times before Congress to offer testimony at hearings. A few quick logistics points, and then we can get started. First, I want to remind everyone that you will be in listen-only mode, but we encourage you to submit questions for our speakers as you have them. We will have a question-and-answer discussion period at the end of the presentation, and I'll read questions aloud on a first-come, first-served basis. I'll be happy to forward along any questions you have once the webinar is concluded, and we provide the panelists' contact information as well. I would encourage you to reach out to them directly if you have any more follow-up you'd like to do. With that, I'll turn it over to you, Dr. Honeycutt.
Thank you. Dr. Shirley will give the presentation, and then we will both address comments.
We'd like to begin by thanking the Council of State Governments for inviting us to speak with you today. In the next 20 minutes, we'd like to give you a brief overview of how EPA clean air rules are derived and the scientific basis upon which these rules are founded. On the next slide, you'll see that benefit cost analysis can be found in the regulatory impact analysis, or RIA, for a given rule. And the goals of RIAs and the definition of significant regulations can be found in the OMB Circular A4. Importantly, RIAs are not subject to peer or public review. And in reviewing recent RIAs, there appears to be an increasing role for fine particulate matter, or PM 2.5. As such, we'll be focusing on the science behind fine particulate matter today. On the next slide, you'll see the use of PM 2.5 in regulatory impact analyses in recent years. And EPA uses estimates of the benefits from reducing PM 2.5 in its RIAs for rulemakings under the Clean Air Act. When this rule is not specifically targeting PM 2.5, these benefits are called co-benefits because PM 2.5 reduction is expected from efforts to reduce other air pollutants. And notably, since 2009, there appears to be an increase in using co-benefits derived from PM 2.5. There are some key changes that occurred in 2009, and those are listed on the next slide. The first is a no threshold model, which then leads to the second change, which is risk attributed to very low, sometimes background levels of ambient PM 2.5. And the third change is an assumption of a causal relationship between PM 2.5 and premature mortality. The result of these changes is that it alters the number of deaths attributable to PM 2.5 and therefore increases the estimate of benefits. So using 2005 as a case study, you can see that pre-2009, for this year, 88,000 or 4% of all deaths in the United States were attributed in EPA analysis to PM 2.5 exposure. For the same year, using the changes listed on the left, you'll see that 320,000 lives or 13% of all deaths in the United States were attributed to PM 2.5. Now the data for 2005 itself did not change, but the key assumptions in the analysis did. On the next slide, we wanted to cover some of the background information for PM 2.5 literature. Generally speaking, there are two types of studies available in the published literature. The first is epidemiology. There are two key studies, the American Cancer Society cohort study and the Harvard 6 Cities cohort study, that are the cornerstones for EPA analysis of PM 2.5 benefits. There are also clinical studies and toxicology that are also available. In the epidemiology, the ACS cohort was previously reported as the POPE, published in 2002 study, which has now been updated to Krusky, published in 2009. And for the Harvard 6 City study, the EPA analysis relies very heavily on the Layden, published in 2006 study. The clinical studies in the toxicology involve exposure of human volunteers or experimental animals to particulate matter, concentrated air particles, or diesel exhaust. Some of these studies show subtle changes in heart rate variability or markers of inflammation, and these changes are often reversible. On the next slide, you'll see that as EPA analysis relies heavily on these two key epidemiological studies, we'll take a moment to explain how these studies are conducted. This is data from one of the two key studies, the American Cancer Society cohort. Each dot represents the risk of dying for an entire county plotted against the county's respective annual average monitored ambient PM 2.5 concentrations. Some factors that influence the risk of dying are considered, such as smoking and weight, but others are not, such as cholesterol levels. The remaining probability of dying is then assigned to PM 2.5 exposure. There are important methodological issues with this type of study design, including confounding by month, weather, other pollutants, errors in measurement exposure. Regarding this last issue, the errors in measurement exposure, this is because Americans spend approximately 90% of their time indoors, and so annual average PM 2.5 concentrations estimated from citywide monitors may not accurately reflect personal exposures. On the next slide, you'll see that, I'm sorry, could you go back one? Two. Thank you. That statistical analysis can then estimate a line through these data points that provides an explanation of their scatter. And the most important attribute of this line is its slope. And that's sometimes interpreted as the increase in risk per additional microgram per cubic meter of ambient PM 2.5. Next slide. So the first two key changes are very pertinent here. That is a no threshold model that calculates benefits down to the lowest model levels of PM 2.5. And the second is related to the first. That's risk attributed to very low, sometimes background levels of PM 2.5. So what this no threshold model does is to extrapolate the shape of this line, the CR coefficient, below levels of PM 2.5 that are considered protective of human health with an adequate margin of safety, i.e. the NAAQS, which is currently set at 15 micrograms per cubic meter, and also below the range for which data exists. And there are relatively few data points near the upper and lower bounds of this range, and this leads to uncertainty about the dose-response relationship outside of these bounds. This extrapolation, due to the assumption of no threshold, leads to two key questions on the next slide. One is, what is the shape of this curve in the low dose range? There may in fact be a threshold or a level below which PM 2.5 does not cause health effects. And the second question is there significant risk associated with ambient PM 2.5 levels? And on this point, clinical studies can add a great deal of information. On the next slide, you'll see that EPA has conducted exposure of human volunteers to PM 2.5. And in a case study published in February of this year, the data describes an exposure of a volunteer to concentrated air particles. This individual had a personal and family history of heart disease as well as other medical issues. And during this exposure, the individual experienced an irregular heartbeat and was transported to the hospital. This report began the process of requesting data under the Freedom of Information Act. And this FOIA request revealed that between January of 2010 and June of 2011, 41 volunteers were exposed to levels of PM 2.5, essentially in the range of secondhand smoke. One individual experienced an elevated heart rate, one experienced an irregular heartbeat, which is the event described in the case report, and 39 individuals experienced no clinical effects. There's additional information available in a 2010 report to the University of North Carolina Institutional Review Board. And in this document, the EPA scientists state that the EPA has been conducting controlled human exposure studies at the UNC campus for more than 30 years. During that time, more than 6,000 volunteers have been studied without a single serious adverse event being observed. And these results generally agree with the observations in the epidemiological literature. On the next slide, you'll see that the risks estimated from PM 2.5 exposure are quite small. What this graph is showing along the bottom is relative risk, and that's the risk of an event relative to exposure. It's essentially the probability of an event occurring in the exposed group versus the non-exposed group. So for example, smokers are 15 times more likely to die from lung cancer than non-smokers, i.e. they have a relative risk of approximately 15. Likewise, smokers are approximately 3 times more likely to die from cardiovascular disease than non-smokers, a relative risk of approximately 3. So we have scientific guidance from the NCI and the World Health Organization and others, as well as legal guidance from the Reference Manual on Scientific Evidence, 3rd edition, that states that relative risks below 2 should be interpreted with caution and should not be considered to support a hypothesized relationship. And that's because relative risks smaller than 2 can often be affected by confounding. And in fact, you'll notice that a number of the studies that have been considered to date, including the ACS and the HSC cohorts, namely Krusky, Layden, and Pope, all have relative risks that are quite small, close to 1. And in such situations, proper adjustment for confounding factors is extremely important. The next slide shows a table of potential confounding factors that have been identified. Some of these have been taken into account in the epidemiological literature addressing PM 2.5, things such as diet, weight, and smoking, but some have not: cholesterol, blood pressure, blood glucose, and others. The effect size of these potential confounders could explain the risk that has been attributed to PM 2.5. Namely, if you compare the column that's labeled effect size versus the reported risks in Krusky of 1.12, Layden 1.16, and Pope 1.06. And I should have said that confounders are factors that can obscure the true relationship between PM 2.5 and the observed health effects. On the next slide, in reviewing the available literature, it's evident that reported effects vary not only between studies, but also within studies. So this is a list of studies that show no association between PM 2.5 and premature mortality. So for example, the veterans cohort, published by Lipfert et al., has found no association between PM 2.5 and premature mortality, a conclusion that's quite consistent over time. Other studies show varied effects by location and by time, including the 2 key studies that are used to derive benefits for rules under the Clean Air Act, the Harvard 6 Cities and the American Cancer Society cohorts. There's also variability that's observed by location, with most studies that have examined eastern versus western U.S. finding associations that were not statistically significant for the West. On a previous slide, we showed you data from one of the 2 key studies, the American Cancer Society cohort. On our next slide, we show data from the other key study, the Harvard 6 Cities cohort. On the left-hand side, you'll see the figure that was published in the Layden et al. Paper in 2006. Each of the letters indicates a city in the Harvard 6 Cities study. So for example, S is Steubenville. When we went back to that paper and plotted the data along with the 95% confidence intervals, it became very clear that there was only one statistically significant result, and that was for Steubenville between 1974 and 1989. The rest of the data points for the other cities in 1974 to 1989 and for all cities in 1990 through 1998 were in fact not statistically significant. On the next slide, we'd like to address the assumption of a cause and effect relationship between PM2.5 and premature mortality. And it's important to note that epidemiology studies alone cannot show causality. The analysis from the EPA on the benefits and costs of the Clean Air Act from 1990 to 2020, published in March of 2011, states that the analysis assumes a causal relationship between PM2.5 exposure and premature mortality. The graph on the right-hand side of the figure shows PM2.5 mortality estimates and their 95% confidence intervals, and that's shown as % increase in mortality, with a vertical line through 0 showing no effect. So if the data point, the blue triangle, as well as its accompanying 95% confidence interval, which is the black line running horizontally, if that lies to the left, or if it overlaps with 0, then that result is not statistically significantly positive and supporting a cause and effect relationship. Only if the point lies on the right-hand side with the 95% confidence interval separate from 0 does that data point support a cause and effect relationship potentially. Now, it's important to note that for some cities, such as Dallas and Houston, those data points actually lie on the left-hand side of the graph and would indicate that in those cities, there is not a significant relationship between PM2.5 and premature mortality. And this is important. I'm sorry. The next slide, please. The EPA analysis, oh, sorry, go back one, please. Thank you. Employs a statistical tool called a Weibull distribution. And what this distribution does is it accounts for the positive associations, but does not incorporate into the model negative or null relationships. So this model assumes that all predictions lie between 0 and 1, and that observations that are 0 or negative are not used to fit the model data. And this distribution is used to support the cause and effect relationship that's outlined in the 2011 analysis and subsequent rules. And this is important because if you look on the next slide, you'll see that this modeling assumption is then applied to risk estimates in the nationwide analysis. So for example, for Texas, as much as 6% of the total deaths in Texas are attributed to PM2.5, when in the data set from Franklin et al. That I showed you on the last slide, Dallas and Houston actually lie on the left-hand side of the graph, and that data would not support that conclusion. So again, there's spatial heterogeneity that's important to note in this body of epidemiology. Now, briefly, we'd like to touch on how benefits are monetized. And in order to do that, I need to discuss the value of statistical life, or VSL. On the next slide, you'll see that value of statistical life is essentially a value of risk reduction. And the way it's derived is by aggregating very small risks on an individual level over multiple individuals until that aggregate reflects a total of one statistical life. This has led to confusion because it's interpreted as referring to the loss of identified lives, when in fact VSL is based on changes in risk rather than loss of life with certainty. And I would refer you to the EPA 2010 document, Valuing Mortality of Risk Reductions for Environmental Policy, which explains this point very well. So as an example, if risk was reduced by 1 in a million per individual in a population of 200 million, that would be a savings of 200 statistical lives, or a value on that risk reduction of 1 in a million. That is not the savings of 200 actual lives. And VSL, or value of statistical life, is also not the same as value added to the economy for a healthier, longer-lived workforce, nor, very importantly, is it a value on a specific person's life per se. On the next slide, we show the basic math of the Clean Air Act benefits and costs as outlined in the Benefits and Costs of the Clean Air Act from 1990 to 2020, published in March of 2011. So essentially, the EPA analysis counted the number of reduced deaths in 2020 times the value of statistical life of 8.9 million to generate a benefit of approximately $2 trillion. Assuming that the costs were $65 billion, then the ratio of benefits to cost would be 30:1. However, a more precise estimate would be based on the estimated benefit of added life expectancy, which was calculated to be between 4 and 7 months added at the end of a person's life rather than a, quote, life saved, times the value per life year gained, a number which has been used by the American Cancer Society, of 150,000. So this generates a benefit of 0.3 trillion and a resulting ratio of 5:1 benefits to cost. Tony Cox has recently published a paper titled Reassessing Human Health Benefits from Cleaner Air in the journal Risk Analysis. He took into account some of the issues we've described today with regard to causality, existence of thresholds, as well as the expected medical advances to generate an estimated benefit of $19 billion, therefore demonstrating that the costs of the Clean Air Act could potentially outweigh the benefits if uncertainties were taken into account. So today I hope we've given you a very brief overview of how EPA clean air rules are derived and the data upon which these rules are based. And we'd like to thank you for your attention and for the opportunity to speak with you today.
Okay, thanks very much, guys. And now I want to give John Walk with NRDC a chance to provide his remarks. And John, I'll go ahead and turn it over to you.
Thank you very much, and I too want to thank you for the invitation. I was very pleased and honored to receive it, to have the opportunity to speak to council members and staff. I've seen the list of people that I hope are joining us in the audience, and it's a truly impressive group of state legislators, their staff, and agency staff. And I know you all are familiar in your day jobs with the law and the requirements of the law, the possibilities and the limitations of the law. So that's where I want to start my remarks, just to put things in perspective. We had a very interesting presentation from the Texas CEQ that admittedly for all of us was probably complicated and complex because the topics are complicated and complex. So I want to step back and offer some perspective on how those issues fit into the regulatory system, why they're important, but where their limitations are. First and foremost, as everyone knows, the job of the Environmental Protection Agency, the #1 job, is to implement and enforce the environmental statutes that were adopted by Congress. EPA receives those words in bills that have been signed by the President, and they're supposed to put them into effect. Now, the other side of that coin is it's not EPA's job to engage in social engineering to optimize outcomes according to what some economists think or what politicians of one political party at any time in our history might wish the law were. They have to carry out the law that was passed. In this case, we're talking about the Clean Air Act of 1990 that was adopted by 89 senators, including both from Texas, I would add, 401 House members, and signed by a Republican president. And it requires certain things. Some of the things it requires are clean air rules that may not take cost into account at all. When we define clean air that is healthy or unhealthy to breathe in this country, the Clean Air Act prohibits consideration of the economic impacts of compliance, and we have a unanimous Supreme Court decision that says so. You have to consider medicine and science, but not accounting or profits or political preferences. By the same token, there's been talk on so far about reducing mercury and other toxic pollution from power plants and the really tremendous reductions in soot pollution or particulate matter, PM 2.5, that comes when you install the pollution control equipment that happily scrubs soot from the smokestack at the same time it scrubs mercury and arsenic and lead and carcinogens. Again, Congress required EPA to base those protective standards for the American people based upon what technology can achieve, what the best actors have achieved in reducing pollution. It's not a cost-benefit test. So where does cost-benefit enter in? Well, it enters in purely for informational purposes under an executive order that is unenforceable and that has really zero value under the law, which is to say it doesn't change the statutory criteria or standards that EPA has to follow when it issues rules. Now, that's not to say that information is not valuable and interesting and informative for policymakers and folks like us to consider. But this so-called regulatory impact analysis, which is where EPA conducts its cost-benefit analysis, is purely for informational purposes, and whether or not benefits outweigh cost, I just want to emphasize, have no bearing under the law. But again, happily, these clean air rules that we're discussing have benefits that overwhelmingly, vastly outweigh the compliance costs, and I'll get into some of the reasons for that. Now, I just want to address a couple of things. First of all, when EPA issues a proposed rule, they also issue this proposed cost-benefit analysis of its proposal, and there is an opportunity for public comment on that. I think the suggestion was made in the earlier presentation that that's not the case, but in fact it is. I comment on those regulatory impact analyses all the time. The Bush administration has basically done exactly the same thing as the Obama administration in addressing many of the critiques that were raised in the prior presentation. For example, the Bush administration found that PM 2.5, soot pollution, is a non-threshold pollutant below which harmful effects have not been found to stop occurring. The Bush administration extensively assigned benefits to reductions in PM 2.5 under the air toxics program. So, for example, the so-called co-benefits that we saw on the slides put up earlier. The Bush administration, for many, many rules, I can give you half a dozen or more examples, assigned benefits to reducing PM 2.5 when the under air toxic rulemakings where PM 2.5 was not being directly targeted. By the same token, the Bush administration employed exactly the same benefit cost analysis, assigning $8 million per year, basing it on the value of a statistical life and not the value of a statistical life year. Let me explain quickly what that means in English. What in the world is a value of a statistical life year? In English, what that means is the value of an elderly person who's only going to live for one more year is less worthy, less valuable than the value of someone who's going to live 5 more years or 10 more years. There was a big political controversy over this in the Bush administration, and that technique to economic cost-benefit analysis came to be called the senior death discount. The Bush administration actually switched to it for about a 1-year period, created a huge uproar because people were able to figure out that they were valuing the lives of senior citizens at 37% less than the rest of the population. That's what the value of a statistical life year is. What the United States government has always employed, except for that 1-year aberration before the Bush administration dropped it like a hot potato, what they've always done is they said, you know, for purposes of regulatory information on cost-benefit analysis, we consider all lives worth $8 million a year, whether it's your grandmother who's going to live 5 more years or your daughter who's going to live 65 more years. Now, you can argue about that, but frankly, as an environmental advocate, I'd welcome that debate. If someone wants to have that debate again in public and explain why the lives of senior citizens are worth less, then let's have that conversation. But I don't think it's going to change the way the approach we have to doing things. So, in light of that, you know, the approach that we're using now is exactly the same approach that we've used since the Reagan administration, the first Bush administration, 7 out of the 8 years of the last Bush administration. let me turn quickly to this suggestion that that PM 2.5 pollution is less harmful than EPA says it is, and there were a lot of doubts raised. You know, for me, very much in the weeds of this stuff, but the weeds are important. But a lot of doubts raised about the way we view PM 2.5 pollution and its harm. Let me just be very, very clear and put this in perspective. Those doubts that were being raised are very much in the minority view within the scientific community, and that is true under the current administration. It was true under the last administration and the administrations prior to that. We have a widespread consensus from the National Academy of Science to the National Research Council to the World Health Organization that there is a causal relationship between soot pollution and death. The World Health Organization has estimated in recent years that upwards of 1.3 million people die around the globe due to air pollution in just major cities, with most of that, with the pollution that's most responsible for that being PM 2.5. EPA, under the Bush administration, again in 2006, conducted a so-called expert elicitation of the most esteemed air pollution epidemiologists and toxicologists from around the United States. And 10 of those 12 experts thought, quote, there was strong scientific support for a causal relationship with best estimates ranging from 90 to 100%. And that's a causal relationship between that pollution and death or premature mortality. Again, you find the same thing in National Research Council reports, NAS reports. You know, I have heard Texas raise these questions before. I've also heard the American Petroleum Institute raise similar questions. And I just want to leave you with the understanding that those views are very much in the minority. And I'd be happy to provide you with lots and lots of documents that bear that out based upon the studies and other things that I just pointed to. You know, just touching upon a couple of things that were mentioned. There were some exposure studies that were put up on the slide. The only thing I have to say about that is those were short-term exposure studies, as you would expect from a clinical study where you're putting people inside of a chamber. The mortality estimates that have been found by the National Academy of Science and the World Health Organization, those are long-term exposures, many, many years. But you know what? When you're talking about concentrations in the ambient air that people are exposed to every day of their lives, the long-term exposures are what we do care about, as well as the short-term exposures. It's not surprising that you're not going to have those very, very profound impacts from limited short-term exposure studies. The bottom line to take away from this discussion of the Clean Air Act and these regulations is that across the globe, across political administrations, there's agreement that this soot pollution is deadly. It is understood to cause even more harm than we thought, even as recently as a few years ago. As we speak, EPA's body of scientific advisors outside the agency, the Clean Air Science Advisory Committee, is actually recommending that EPA strengthen the soot standard in order to protect Americans. I want to mention a study, a very important study that's coming out between Thanksgiving and Christmas called The Global Burden of Disease by the World Health Organization, the University of Washington, and a joint industry EPA research body called the Health Effects Institute. It is expected to estimate that the number of deaths worldwide caused by PM 2.5 pollution has been significantly underestimated, and they are going to raise their estimates of worldwide deaths and U.S. deaths by a significant amount. I don't know the exact amount, but I have spoken to some of the people who are looking at the draft report, and it's going through peer review to be published in a publication called The Lancet. You should look out for it when it comes out. For this reason, the EPA under the current administration and under the prior administration was fully justified in finding that tens of thousands of lives would be saved by adopting these stronger air pollution rules that the Bush administration did and the Obama administration did following suit, using the long accepted figure of upwards of $7.8 million for a saved life. That results in benefits that vastly outweigh the compliance cost by factors of anywhere from 25 all the way up to 100 to 1. And again, just returning to my original point, that's all good social policy. It's all very informative to let us know that we're getting real benefits from the law. But when it comes right down to it, the law is a particular document, in this case the Clean Air Act, that must be followed by EPA regardless of what some economic analysis would show. And that is for good reason. We are dealing with carcinogens, we are dealing with brain poisons, we are dealing with deadly soot pollution, and Congress wrote a law that required that pollution to be cleaned up as much as technology could deliver. EPA has followed that law, and we are in a much better shape because those sources of pollution will be cleaned up, and happily we have strong evidence that society will enjoy vastly more benefits than the compliance costs of reducing that pollution. With that, I've come full circle. Let me stop, and I will be happy to entertain questions. Thank you.
Hey, thanks so much, John. And before we get into some of the questions, I wanted to see if maybe Dr. Honeycutt or Dr. Shirley wanted to provide, maybe we can do a little back and forth here before we get to the questions, with anything that was raised in the presentations. Even for John, too, is I want to give you guys an opportunity to dialogue with each other, because we have a really nice opportunity here to have real experts deal with your technical questions. So I don't know if you guys had anything you wanted to add there for discussion points before we turn it over to our listener questions.
Sure. Could you turn to slide 14 in our presentation, please? And while you're doing that, I'd like to address the senior death discount. That your characterization of what a value of statistical life isn't accurate, and I would refer you to EPA valuing mortality risk reductions for environmental policy, which is referenced in our slide 18, for that, because that's just an incorrect characterization. And also, Trudy Cameron has a very extensive study on this, and that's just not correct. It's a sort of a slanderous term applied to it to really scare off people from actually using it. And this isn't really about politics. It's about good science. This is the wrong slide 14 is the. No, 14. Is this before?
The one that's titled Data from Harvard 6 City Studies?
Yeah, that
one. Thank you.
Okay, if you look at where 15 is, that's where the current standard is on the right-hand side. And EPA is proposing to lower it somewhere below there between 13 to 11. And the data show that as far as your risk of premature mortality, there is no measurable increase or benefit. And there has not been any data that demonstrates lowering the standard from 15 to 13 or 12 or 11 will produce a benefit. As far as this being a minority view, that's just not true. The EPA's CASAC, who reviewed this, half of those people on the CASAC, or approximately half, are actually authors of the studies that are used to support this, the Harvard 6 City and the ACS studies. So I'm not really quite sure that they would be totally unbiased. And you talk about estimates from around the globe. Well, you're throwing in other countries, third world countries, that have much, much, much higher PM levels than we do. So that comparison is not a fair comparison. And you mentioned the expert elicitation study. Well, 6 of those 12 authors said the lower bound of that should be 0. And in fact, that the number of deaths saved would be, the lower bound is 0. And that information wasn't transmitted to the administrator nor to Congress. And that's our main argument, is that the entire amount of information isn't being presented to the public and the policymakers. And in fact, one of the KSAT members said the benefit from lowering the PM standard could easily be zero or no benefit. And in this case, it's not a question of science, it's a question of policy. And that's what we're trying to tell people.
Well, this is John Walk. I will point out for those who are interested in looking into it that all but two members of the Bush administration's science advisory body for the last review of the PM standard in 2006 agreed that it should be strengthened and that there were harms occurring below 15. I think you will see that same overwhelming near unanimity or even unanimity with the current body that is examining the standard, who believes it should be strengthened down to 11 or 12. The same is true of the EPA scientists. It is just, I don't even know how to respond to the claim that there are no benefits below 15, considering that the overwhelming majority of members of the Clean Air Science Advisory Council under Bush and Obama have strongly disagreed with that view. The Clean Air Act requires EPA to set standards to protect public health with an adequate margin of safety, and EPA has proposed to do so to lower the standard to between 12 or 13. We are urging 11 based upon overwhelming scientific literature. I was expecting you to say something different than to essentially level an ad hominem charge against some of the authors of the original studies. Well, of course they were some of the original authors, or the most expert in their field, but that characterization of their bias is, it kind of misses the point, because you've got people who agreed who weren't the authors of the study. In fact, the overwhelming agreement was that the standards needed to be raised. Lowered. I fully stand by my characterization of the value of statistical life year. I'm sure it is uncomfortable to have that referred to as a senior death discount, but that's exactly what the outcome would have been in practice of switching to a value of a statistical life year. And the Bush administration apparently agreed, because they dropped it like a hot potato. Congress adopted a resolution that I think was unanimous in decrying that approach, because it did devalue the lives of seniors. Again, this is an academic debate, because there's no stomach whatsoever among politicians to value the lives of seniors less based upon the fact that they live fewer years than those of us that are younger. So I think we can just proceed with the approach we've always done, which is to base it on the value of a statistical life and assume that life is precious and should be saved.
Well, I will provide everyone on this phone call with the information that we've talked about, and actually discussing in detail the senior death discount and how it's not that. I'll be happy to provide that to you. And again, I would refer you to the data on the screen. And this is one of the two studies that EPA is basing lowering the standard on. EPA is ignoring statistical significance. They're saying that lowering PM will save lives, when the data just doesn't support that. And I will again refer you to the data on the screen.
Well, KSAC's saying the same thing, so you should include them in your indictment as well. The Clean Air Science Advisory Council is in full agreement with EPA. They believe that EPA should have strengthened the standard in 2006, and the political process blocked that from happening. So at least acknowledge to the audience that what you are saying is contradicted by the strong majority views of the Clean Air Science Advisory Council, as well as the expert elicitation, as well as the National Academy of Science. I mean, that at least we can be clear about that.
Well, it would be precautionary, and I think that's where they were going, in being precautionary. But if you look at the data, there is no data that supports causality at 15, and there is no data that shows lowering the standard from 15 to 13 or 12 or 11 will result in life saved. There's only extrapolations from very high exposures down to lower exposures, but the data doesn't exist from 15 down to lower exposures.
Okay, this is Brian with CSG. This is the sort of debate and discussion that I'm glad we were able to incur here with the webinar. We do have a couple questions that I wanted to get to from our participants, and then maybe we can go back to addressing some of these points that each of the panelists made. The first one wasn't addressed to anybody, so I'll put this up as a jump ball to our panelists. If there is no threshold for health effects from particulate matter in EPA, and EPA is not to consider costs and benefits, why isn't it set the SIP standard at 0?
This, John Walk, I can take that. That's a very good question. And it basically turns on the way the law is written. What the law says is that EPA is to protect public health with an adequate margin of safety. And in the Supreme Court case that I mentioned, this question of ozone and PM 2.5 being potential non-threshold pollutants was specifically raised and then addressed by the court. And what the court found was that there were enough words and terms in the relevant Clean Air Act language to provide the administrator with discretion, that it was within her judgment to decide things like, what is the relevant size of the vulnerable subpopulation? Is it one person? Is it need it be that small? What is an adequate margin of safety? That's the legal answer, where the court has provided EPA with the discretion to avoid going to 0 based upon those types of judgments and policy calls, as Dr. Honeycutt correctly said. The other half of the issue is really the rigor of the epidemiological studies and other studies, as well as certainty or uncertainty associated with those studies. Dr. Honeycutt and I are in full agreement that, even if it is theoretically a non-threshold pollutant, which it sounds like his colleague doesn't believe, but let's take the question as it was asked. Even if that's the case, we don't have the robust literature for harm down at 0, 1, 2, 3, and 4 that CASAC believes we do at 12, 13, and 14. Once you factor in that adequate margin of safety, that pushes you down to say 10, 11, 12. It doesn't push you down to 1, 2, or 3. And that, again, is a function of those two factors, and I'm kind of oversimplifying here, but the literature available as well as the discretion that the law provides to the administrator to avoid going to 0.
Would Dr. Honeycutt or Dr. Shirley, would y'all like to offer any thoughts to that?
This is Stephanie Shirley. As far as, I can't speak to the law, but as far as why 0 isn't being proposed, I can tell you that the rationale that was stated in the proposed revision of the PM NAAQS is that the proposed range is based on, quote, levels that were somewhat below the long-term mean PM 2.5 concentrations reported in the epidemiological studies, and that's in the most recent EPA proposed NAAQS for PM section 3.A.3.
Okay. This next question will be for John. It says, does NRDC support making the data that underlies particulate matter health effects claims publicly available?
Well, I am not going to get into the dispute that dates back to the, mid-90s or 1996, 97 at least, when that argument was all the rage. There are good reasons on both sides of the argument. On one side of the argument, you have a reluctance or opposition by the researchers to provide data about their participants and the subjects in their studies. That's a legitimate research and academic concern, I suppose. On the other hand, NRDC has long been a proponent of transparency and rulemaking and regulatory affairs, where information like that is useful to my side as well as the industry and states. You know, I see both sides of the issue, but I'm not really going to stake a position out on it. I will say as an aside that I don't think that the you know, the motivations back in 1997 from the industry folks calling for the studies were the best motivations in the world, because it was clear that they opposed the strengthening of the standard no matter what, and that was when we were lowering the ozone standard by a good you know, 20, 25 points, which I think most people thought was absolutely necessary. So I think they had some questionable motivations about trying to rip apart the science, but let me leave it at that.
Okay. So a question for Texas CEQ. Your studies don't show causality on particulate 2.5 with the increased threshold levels coming down. Do you have other studies on other criteria pollutants that show that with no causality? Or is that kind of a one-off for PM 2.5? Or I don't know if you wanted to speak to other criteria pollutants, or.
I guess I'm not understanding the question. Do other criteria pollutants have been shown
Sure.
causality for something,
Well,
like carbon monoxide?
Sure. You know, the question basically, do you have other experience with other criteria pollutants where lowering the thresholds don't show causality, or is this something just use the 2.5 PM standard as an example here? Are there other studies that you found that show similar results?
Well, I guess let me answer the question this way. Okay, we don't disagree with the basis for all 6 of the NACs. I mean, 3 of the NACs we agree with EPA with, and 3 we don't. And some of those don't really deal with causality, like lead, for example. Okay, we do think that, you know, lead causes the effect that it's attributed to it, but you know, lowering the standard from 1.5 to 0.15 micrograms per cubic meter did very little, if anything, to reduce exposure to lead, because air is not it's a very insignificant source of exposure to lead. So you know, lowering the standard for lead hasn't or will not help lead exposures that comes mainly from other sources like lead-based paint and toys and food and things like that. So I mean, I guess in some instances, causality for whatever endpoint is well documented, and then I guess in some instances it's not.
Okay, those are our questions so far. I know we've got a little more time here. I wanted to throw it open again for our panelists to maybe raise some other discussion points that they would like to address with each other, if you had any. I mean, I don't want to.
Well, I think one of the things that's sort of my, I guess, peeve about this is the NACs, unlike every other chemical out there, you know, there's only 6 compounds that are regulated under the NACs. The other tens of thousands are regulated by the states. And because the NACs are designed the way they are, we have no risk management options, or very few risk management options like we do with other chemicals. And to me, in my mind, that sets the bar higher for the science. It doesn't set the bar lower. And I think if you talk to most epidemiologists about a relative risk of less than 1.2, they will tell you, and read epidemiology textbooks, and we can send plenty of references Those risks are tiny, and you should interpret those as being causative with extreme caution. It's not just us saying that. It's epidemiologists from around the world. So I guess that's our point. Some of the science here is being really overstated, and I think that's where we are.
Well, for my part, I look at the fact that a unanimous body of EPA science advisors drawn from academia, industry, state and federal governments recommended a strengthening of the ozone standard based upon exactly the epidemiological studies and information that Dr. Honeycutt and his colleague have criticized. All but 2 of 22 members of the Clean Air Science Advisory Committee recommended a strengthening of the PM 2.5 standard based upon the same types of epidemiological studies and other types of information that they have critiqued in their slide proposal. I suppose it's easier for me to accept the notion that EPA may be engaged in a conspiracy or bias than it is all of these different scientists drawn from industry and academia and elsewhere who have joined the very strong consensus that, by the way, is reflected among global researchers for the World Health Organization and at the National Academy of Science. I'm as open to criticism and skepticism of the kind that's being raised by TCQ as anyone, but it just strikes me that you reach a threshold where there is so much consensus as reflected in the unanimity and near unanimity that I'm describing, and I think that's powerful. I think it easily supports what EPA is doing under the law, and I will note that the Bush administration's decision to ignore the near unanimous recommendations of its science advisors on the PM 2.5 standard resulted in a lawsuit being decided against it the first month of the Obama administration. The court ruled that the agency had acted arbitrarily and failing to explain why it was contradicting the near unanimous views of all of those outside science advisors. So now you have EPA proposing rulemakings to strengthen the smog standard and the soot standard in accordance with those unanimous and near unanimous views. I'm no toxicologist. That is very powerful to me, and I have read the proposed rulemakings and the Case Act documents underlying the rationales for their recommendations. And it would take us months to go through that. We don't have it. We don't have that time. But again, that that unanimity and near unanimity, I think is the quickest concise rejoinder to much of what you've heard today, which again are just not consistent with those bodies' recommendations. Okay.
Well, none of the Case Act are from industry. Only one is from the state of Vermont. The rest are all academics from academia or from research labs.
Dr. Honeycutt, that's not true. The PM 2.5 group in 2006 did have industry representatives.
2006, but not the current one.
Well, I mean, I see you resort to these kind of ad hominem, critiques at any point where it's, the evidence isn't consistent with your views, and I just don't think that's fair to those researchers.
How was that ad hominem?
Well, you're basically saying that where they work determines what they say.
Oh, I was just pointing out that what you said wasn't correct now.
Well, it was true in 2006. Vermont is a state, but again, I think these people are contributing their time away from their day jobs and their families because they believe the scientific information that they are recommending. And I just don't think it's fair to say that because they're not from Texas or because they're not from Exxon with the current panel, when there were people like that from 2006 that said the exact same thing. I just don't get that.
Well, out of the current elicitation panel, 6 out of the 12 said the lower bound should be 0. The negative data should be included. 6 out of the 12, but that data, EPA did not use that data.
Well, and as you correctly said, that's a policy recommendation that the administrator need not follow.
Well, I think she should be aware of it.
She's aware of it.
It wasn't transmitted to her in the policy assessment.
Well, I dare say she's aware of it, but you're certainly free to tell her. I think you're giving short shrift to the way that information is actually communicated inside the agency. There are scientists who work with KSAC, and I guarantee you she's aware of that.
Well, we're not privy to the internal workings of EPA, but we are privy to what they put out to the public.
Okay, well, I just think that's beside the point, because what they didn't recommend anything anywhere close to 0. We know what they recommended. It is a strengthening of the standard, notwithstanding your agency's views that there are no benefits from strengthening the standard. And again, that is a small minority view among the science advisors that have weighed in with EPA.
Okay, folks, this is Bryden with CSG, and wow, we've had a great debate today. I hate to cut it off here because I'd love to go listen to you guys speak for the rest of the afternoon, but I know we have our participants probably need to run here. But I wanted to take the time, one, to thank Dr. Honeycutt, Dr. Shirley, and John. Thank you very much, John Walk with NRDC, for joining us today. You guys have really given us a lively debate and discussion, and we're looking at the monitors from all the comments. People are really enjoying this today. So thank you very much for providing your insight and giving us some context today on what really are some complex and often jargon-filled world of EPA clean air rules. I just want to remind all our participants that we will send out a notice when the webinar goes onto the website and is put on our Knowledge Center. If you have any follow-up questions for me, it's bross@csg.org. But I would encourage you to reach out to our experts here. These are the folks who really know these issues front and back if you have any follow-up questions. With that, I also want to remind you that our hotel and early registration cutoff dates are coming up soon for our CSG National Conference in Austin in late November. So please go to csg.org and sign up now. With that, thanks everyone for participating today, and have a good afternoon.